connecting. Just bear with me while this connects. While it's doing that, I can do this, I think. Just bear with me, connecting to YouTube Live. Also, just into the chat, just please put when you're taking your next OET. I'll also be curious of the date. Cool, that's working, sweet. And finally, let me do this. And I should be ready to go in a second. Hold on, let me get back to slide number 1. Okay, that's good. And let me share my screen. Not sure, December 3rd. Okay, people are choosing different dates there. Cool, all right. And I think we're good to go. Is everything working all right? There's a bit of a lag on the camera here, strange. Anyway, let me just present. Hello, everybody, including those of you on YouTube. My name is Jay. I'm one of the expert OET teachers here at E2 Language. If you're thinking about doing your OET and you feel like you need some preparation, do check out the website. We've got lots of practice tests and methodology videos and all sorts of stuff that will help you on test day to pass this exam and to enter the medical profession in which you work. Cool. I hope everything's going okay. In this live class, we're going to focus on OET reading part A. In fact, we're going to look at a super skill that you need called scan reading. So let me just quickly get started here. So OET reading part A, you will have 4 texts. Okay, sometimes 3, but usually 4 texts, and there'll be different texts. I'll talk about them in a second. Now, what you'll also have at the end is a summary. And the summary will have about 4 paragraphs. And in these paragraphs will be about 30 gaps. Your task is to scan read the text and to find the right word to fill the gap. The problem is you only have 15 minutes to do this. So what you need to do is you need to read incredibly quickly. And that's what we call scan reading. And that's what we're going to practice doing today in this live class, okay? So the text that you may have to read from to find the right word to fill the gap include texts like Q&A, questions and answers. You might have to look at a research abstract. You might have to look at a table of statistics, a definition, an FAQ, or perhaps even a case study. So that texts vary and you'll get 3 or 4, usually 4 of these texts, okay? So imagine if you had to look at a table of statistics and you have to find a specific number or a specific item from the y-axis, for example, to fill that gap. You need to be able to read that very quickly in those 15 minutes. So a research abstract might look like this, for example. You'll see this on the paper in front of you. Just have a look at this for a few seconds because it's incredibly complex. And what you'll need to do is there's the summary with gaps, and you write the answers on the right-hand side there. Okay? So let's talk about scan reading because this is critical. Scan reading is like this. Okay. So on the left-hand side, you have your text, and you can see a key word there. In fact, what you'll be doing, let me start again. On the right-hand side, you have the summary, and there's a gap in that summary, right? Let me get out my pen so I can explain this a little bit better. Just bear with me. Okay, so here's the summary here, and you have a gap that you need to fill. And let's say you can sort of see some of these words here, and you realize that the word you need, you quickly scan read this text with your eyes like that. And what you're doing is you're searching for that keyword there. And then in order to get the right answer, you'll fill that word in there. Sometimes you'll leave it exactly as it is, and sometimes you'll need to change it. I'll show you that as well. Let's just do some practice so you know what I'm talking about. So on the right-hand side, you've got your summary here. On the left-hand side, you've got your text. You have 20 seconds to find this answer. Go. How did you go? 20 seconds is maybe a little bit quick, but good, nice, looking good, looking good, looking good. Well done. Let me disappear again. Correct. The answer is serious. Okay, so you've taken that word there directly from that sentence and you've put it in here. Here the sentence says nosebleeds usually aren't serious, and here it says nosebleeds aren't typically serious. So it means the same thing. It's written a different way, and that's the key word that you need to find. Let's do one that's a little bit more difficult this time. Let's have a look at that chat. Interesting, interesting, interesting. Okay. Let's just think about this for a second. Let's read the summary, okay? We read the sentence in the summary. There's a gap. Something can actually cause more bleeding. Something can actually cause more bleeding. We need a noun. We need a noun. We need a noun. A thing, something. We need a noun. So we look over here. And it says, stay calm. If you start to get nervous, it can actually make you bleed more. Try to relax. So some people have written nervous. Nervous can actually cause more bleeding. What is wrong with this? This is wrong. It's the right word. It's definitely the right word. We need to change the word form so it fits that gap to fit grammatically. So how do we change the word nervous to fit grammatically? What's the correct answer there? Just type that into the chat. Yes, some people have got it. Good. The answer is nervousness. Nervousness. Some people wrote stress. That might be a possible answer as well. But what I want you to start thinking about now is you can take that word from the text, that's fine, but when you put it into the gap, it has to fit grammatically, so you may have to change it a little bit, okay? You may have to change it from nervous, adjective, to nervousness, noun, or you may have to add a preposition or an article or something like that, okay? Let's keep practicing. Here we go. So what's the key word here? When sitting, try to keep your heart something your head. So look for a keyword like sit. How did you go? Good. Somebody wrote above head level, but that would be wrong because that would say try to keep your heart above head level your head. So that would be wrong. So we're looking for a single word here, below. Okay, this is tricky. And what I'm trying to do here is to purposely trick you because that's what happens in the OET. More often than not, you have to change that word or think critically about what that word is supposed to be, okay? So here, let's have a read of the text here. Oops, what am I doing? So this says, keep your head above your heart. So the head, obviously, there's the person. Keep your head above your heart, right? This says when sitting, try to keep your heart above your head. Well, that would be wrong. Try to keep your heart below your head. Okay, good. Just a little trick there. Let's do another one. All right, let's go through the answer here. So let's read the summary. It says, tilting forward will keep something from going down your something. Okay, this says lean, which is a synonym for tilt. So that's okay. And it also says forward, and here it says the same word forward. So we know we need to look here. Lean a little bit forward. This keeps the blood from draining down the back of your throat. Okay, fine. So let's look at the answer here. So you could use the article. You could say this will keep the blood from going down your throat, or you could just say will keep blood from going down your throat. And so we've taken words directly from there, but this time we've taken two words, okay? Let's have a look at this chat. Is everybody happy? It looks like everybody's happy. That's good. All right, let's keep going. This is good practice. Here we go. I'm a very cruel teacher. I'm giving you very little time. Uh-oh, some people are getting it wrong. Let's look at it carefully. Some people are writing 5 to 10 minutes. Let's look at why that's wrong. Let me disappear. Okay. You should pinch your nostrils closed for up to. All right. Now remember in this reading part A, you can 3 words maximum. You can use 3 words maximum. You cannot use 4 words. You can use 1, 2, or 3 maximum. Okay. So here we're looking here. We've got the word pinch. Fine. Pinch your nostrils closed. Use your thumb and index finger to hold your nostrils closed for 5 to 10 minutes. Well, there's 1, 2, 3, 4 words there. So that is just going to be wrong. If you had all of those words, you would be wrong. You would lose the point. Okay. Just try again. Please put into the, and have a look, just before you do, have a look at these prepositions here. Pinch your nostrils closed for up to, I'll give you a hint. I want 2 words, maybe even a number. Good. Okay, fine. So you can write 10 minutes there. That is the correct answer, is 10 minutes. If you wrote 10 TEN, that would also be correct. You can use the number or the word there. But the critical thing is pinch your nostrils closed for up to 10 minutes. So you need to read very carefully. Again, the trick would be that the OET would get you to write all 4 of those words into the gap, which would be incorrect. It's up to 10 minutes. Let's keep going. How did you go? Good. Nice. Somebody wrote, okay. A few people got it wrong. I'm going to write those. This is wrong. This is incorrect. Why? Let's read it. Pinching your nostril can help to stop the flowing of blood. Oh, it's actually pretty close to being correct, actually, now that I read it. But there is certainly a better answer. The better answer is stop the flow of blood. Stop the flowing of blood. Stop the flow of blood. Maybe you would actually get flowing correct because it's okay. But again, just a little hint, make sure you transform that word to fit grammatically as best as you possibly can. Okay, now we're going to move on to some statistics. So I don't know how good you are at reading statistics quickly, particularly reading graphs and tables, but let's do some practice here. Just before we begin, I don't want you to look at this question. I don't think you're seeing my screen actually when I draw on the screen. I've just realized that. That's fine. Let me get out this instead. Okay. Heart failure statistics. Hold on, actually. I'm going to do something different. Just bear with me. What am I going to do? I'm going to do... if I do share my entire screen, then you'll see my red pen. But no, that's okay. I'll just stick with what I'm doing. Don't worry. Sorry, little technical glitch there. I just realized that I've been drawing on the screen, but I've just realized that you can't see it. So it was a complete waste of time. Before you look at the question here, let's just look at this table here. Heart failure statistics, heart failure statistics. So we moved on to a different topic. On test day, all the text will be about the one topic. We had nosebleeds before. Now we're talking about heart failure. So this is different. Okay, let's have a look up here. So we've got the year, 2010, 2015, 2020, 2025, 2030, and an overall change. Fine. Prevalence of heart failure, 2.8%, 3%, 3.1, 3.3, 3.5, overall change of 25%. Direct cost of heart failure. Well, in 2010, it's going to directly cost $24.7 billion, 32.4, 42.9, 57.5, 77.7. Overall change of $215 billion direct cost. And then we've got indirect costs here. That's enough from me. Please answer question 1. Cool. How did you go with that one? Nice. Looking good, looking good, looking good. Okay, this is a little bit tricky, actually. You could have written a few different things here. Let me annotate on the screen. I'm pretty sure I can draw here. Okay, cool. I should be able to draw. So you could have written 13. You could have written $13 billion. Sorry, that's not working very well. There's different ways you could have written that. That's fine. That's fine. That's fine. Let me clear my drawing there. Okay, fine. Let's move on to the next question. Nope. I'm trying to clear my drawing. Annotate, spotlight, give me that thing. Okay, here we go. Second question. How did you go? This was a little tricky one. Let's see. Yes, nice. Looking good. Well done, well done, well done. Looking very good. Correct. The answer is 0.1% there. So how did we do this? So from 2015 to 2020, now we know that the years are here on the left-hand side. So we're going from 2015 to 2020, and we're talking about the prevalence. We knew that this column was about prevalence, and it was an increase. So how much does it increase from here to here? And that's a percentage. If you just wrote 0.1, it would be incorrect. You need to write 0.1%. Or 0.1% would also be correct, by the way. Awesome. Well done. Here we go. Next one. Let's have a look at that chat. Nice, looking good. Well done. Well done. This one is about using your intuition more than anything. In fact, here's a really good tip in reading part A. That is, you have 15 minutes. You have 30 gaps. That's 30 seconds per gap, right? Some of them you're going to get stuck. You should leave the ones you get stuck and come back to them. Or, here's the big tip. If you feel like you just know what the answer is by the context, then you should just guess and move on to the next one, okay? Because your main objective in reading part A is to complete the summary from 1 to 30. That is the objective. If you complete all of the gaps, all 30, even if you get a few wrong, there's no negative marking. That's much better than just completing 20 and going, okay, I definitely got 20 right. Because that's not good, because some of them you can guess. You'd much prefer to get 25 or 28 rather than definitely getting 20, okay? So when we read this one here, The direct costs of heart failure will something, we know we need a verb, will something from 32.4 to 42.9. Okay, the answer is it will increase from. So we're not actually taking any words from here. We're just saying, okay, it will, is it going to decrease? Is it going to plateau? No, it's going to increase. That's all. That was a bit of a tricky one. Next one. Okay, I almost tricked myself then. I couldn't get the answer until the 1 second mark. Good, 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 good. Okay, let's read the question or the summary. From 2010 to 2030, bang. So we go 2010 to 2030. Okay. The overall prevalence, and we know we're looking here, the overall prevalence of heart failure will be 25%. It's not a great question, actually. It should have said the overall change in prevalence. So my apologies. If you got that one wrong, that's my fault. It should have been the overall change in prevalence should be 25%. That's a better question. Here we go. One more. Nice, nice, nice. Looking good. The answer to this one is the indirect costs of heart failure will be 15.1 billion in, look at this preposition that tells us we need a year. Okay, so we're going indirect. We go to the top of the column. 15.1, okay, 9.7, 11.3, 30, 15.1 in 2025. Okay, this is the type of skill that you need in this part of the test. This is called scan reading. Let's practice some more. This time it's going to be more difficult. I'm going to give you more time. You can have 30 seconds per question because the text is going to be longer and you'll have to do a little bit more reading, okay? Now, just before we begin, let me just, don't look at that. I want you to just read this very quickly, scan read this from beginning to end. I'll give you 30 seconds just to scan read. I can't get the timer going. Okay, just a little question before you start your uh-oh, I've lost my marker. How do I get my marker back? There it is, great. Just a little question before you begin answering the questions. What is this text about? Please put into the chat what this text is about. What are you looking at? Yes, hair loss, women's hair loss, exactly. Exactly. Well done. Good. Okay, here's the thing. The method that we believe is best at E2 Language, and the way that we develop these methods, by the way, is doing the test ourselves. So we sit there with a group of teachers and we sort of reverse engineer our thinking. We do it and I say, hey, how are you answering these questions? And it's like, okay, what I'm doing is I'm scan reading the passage, I'm looking at the summary, I'm finding a key word, I'm going back to the passage, I'm filling the gap. One of the things that you do need to do at the beginning is just quickly scan read the 4 texts before you look at the summary. I believe you need to do this because you want to look at those texts and go, okay, that one's a research abstract about whatever. The next one is an FAQ. Okay, they're all going to be about the single theme, like women's hair loss, for example. But just by scan reading them, when you go to the summary, you'll know which text to look for to find the gap. If you haven't seen it, you should check out my other video, which is up here on YouTube or here, I forget which side, on reading part A, because I go through the clues and whatnot. But anyway, enough gibbering from me. Whoopsie. Let's do this one. Here we go. 30 seconds starts now. That should say also known as, by the way, that's a typo. Good. Okay, nice. Okay, let's have a look here. Okay, FPHL, or female pattern hair loss. Just let me move this thing out of the way. Okay, or female androgenetic alopecia. I don't know how to pronounce that. So FPHL, also known as, okay, I'm guessing that's going to be female androgenetic alopecia, has a detrimental effect on patients' what? Okay, hair loss in adult women, and has a major impact on patients' quality of life. So let's see the answers here. Whoops. Female androgenetic alopecia has a detrimental effect on patients' quality of life. Correct. Next one. If you get this one, you're a genius. Think about the word form here. Think about the word form. I'm going to give you a hint. It's this word here, but we need to change the form of it. How can we change the form to make this grammatical? Because this doesn't have an apostrophe. If it had an apostrophe, this word would be correct, but there's no apostrophe. People are trying to make it fit. Okay, yes, Zore's got it. Zore's got it, but you've got the wrong spelling. Spelling is important in reading part A, by the way. You must spell it correctly. I'm going to give you another 30 seconds. Let me go back. You get another 30 seconds. I'm going to give you a hint. It's one word. It's this word, but you must change the form of this word to make it fit grammatically. And you must spell it correctly also, by the way. Yes, Zore, well done. Well done, Nachal, you've got it. All right. The answer is miniaturizing. Miniaturizing. Okay, let's see why. It evolves from the progressive miniaturization of follicles. The miniaturization of follicles. So FPHL, female pattern hair loss, occurs as a result of follicles miniaturizing. I can't think of any other way that would be correct. It must be miniaturizing. Anyway, that was super difficult. So please forgive me for that one, but it's good practice. Here we go. Good. The answer to this one is dense. The hair becomes less dense. This says subsequent decrease of the hair density. Okay, so the hair becomes less dense. That's the correct answer there. Here we go. Number 4. Okay, this one's pretty straightforward. It's a word directly taken. Okay, some people have written pathology. This raises an interesting question. Okay, let's think about this. Okay, the something of the disease is not totally understood. Now, in spite of the high frequency of the disease and the relevance of its psychological impact, its pathogenesis is not yet fully understood. Now, I think there's a difference between the meaning of pathology and pathogenesis. I would say in this number 4, you would have to take this word directly into the gap, because pathology and pathogenesis, I believe, means something different. You can correct me if I'm wrong, but I think it's pathogenesis. So if you wrote pathology, it would be incorrect. This, which raises an interesting point, is sometimes you need to change the word for grammar, not for meaning. Okay, we're not looking for synonyms or anything like that. We need to put in the gap, it may need to change for grammatically, like the verb tense, or put an S on the end for the noun, but don't just change the meaning. Okay, you're taking that word, but you're just changing it for grammar, not meaning. Cool. Good stuff. I think there's a 5th question. Here we go. Okay, let's have a look here. Okay. Is variable. People respond to hair loss treatment is variable. Is wrong. Varies is wrong. Variably is correct. Differently would also be correct. Well done. Variably or differently, or even you could even write, okay, so we're taking this word here, variable, okay? Response to treatment is variable. Now, if we're going to take that word, the same meaning, but then change it for grammar, we have to turn it into an adverb. We need to say, people respond to hair loss treatment variably. Or you could have written differently, or even in different ways would be fine. In different ways, 3 words would also be correct, because you've kept the meaning of that word but changed it for the grammar. Okay? Here we go. Good, Donabelle. Well done. Prabha, well done. Nice. Let me give you a hint. I'm going to go back. Let's do this again. There are 3 words that you need to include. 3 words. All right, let's have a look now. Should have been 3 words. Epidemiological and pathophysiological. Nice. Make sure you spell them correctly. If you spell them incorrectly, it will be deemed as incorrect. The answers are here: epidemiological and pathophysiological. Why those two? Well, here it says authors discuss the main clinical. Okay, the research is examined. It's a little bit different. It's probably not a great question. The main clinical aspects as well as the. So if you just wrote one, it would be incorrect because they also discuss the epidemiological and the pathophysiological as well. I think that's all, my friends. That is all. If you need any help with your OET, you can check out this website, www.e2language.com. So do check out that website there if you need any help for tutorials, writing feedback, different subtests, practice questions, etc. Okay, let me get out of here now. Okay, there it is. And let me stop screen sharing. Okay, hope that was helpful. If you have any questions, you can put them into the chat for me. By the way, if you're on YouTube, you're watching this, hit the subscribe button down below so you'll get an alert every time we're doing a video. Any questions about the OET? Feel free to ask me questions on any aspect of the OET, including writing or speaking or whatever. I'm happy to hang around for a few minutes. Just put your questions into the chat. Let me just check on what's happening on YouTube here. Okay, good. Okay, Pooh just got a good question. Which way is easy to start reading, from beginning or from last? Okay, in other words, should you start from the texts or should you start from the summary? Okay. I think what you should do on test day is this. You open up your test paper. You should first identify from the title what you're going to be reading about. This will take you like 3 seconds. Nose bleeding, female pattern hair loss, whatever the topic is, and that will tell you the title right at the top. Because you need to get your brain thinking about female pattern hair loss. You're going to be thinking about hair, density, follicles, all that sort of stuff. Nosebleeds, nostrils, noses, blood, blah, 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 blah. Okay, so you know what you're going to be reading about. You quickly scan read the 4 texts. And I mean quickly, I mean scan read them. It'll take you about a minute to read all 4. You're just quickly running your eyes over, getting an idea of what that research abstract is about, paying attention to keywords, titles, and subtitles in there. Going to the next text, which might be a Q&A, and you'll quickly scan read, look for keywords, because there'll be certain questions that are asked about how long should I pinch my nostrils for, or should I stuff a tissue up my nose, blah, 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 blah. Okay, fine, you got that one. Then you move to the statistics. You're not reading for detail because there's no time. You'll lose all your time. What you're doing is you're basically scan reading. So then when you go to the summary and it says in the summary, should I stuff tissues up my nose? You know which text to go back to. Are you going to go to the research? No. Are you going to go to the statistics? No. You're going to go to the Q&A because you saw that that's where that question was asked. Then you know that you have to read more carefully in the Q&A to find that gap. Okay? So my suggestion is quickly scan read the texts, then go to the summary, and then from the summary you'll know which text to go back to find those words. The biggest tip though of all is your objective is to write all 30 of those, fill all 30 of the gaps in the 15 minutes. Even if some of them you have to guess or intuit, that's fine. This isn't about reading carefully. This is about reading recklessly and quickly. The other thing is the biggest problem that I see is people not transforming the word to fit the gap. So what they do is they take a word like, I can't remember an example that we just saw. Let's say the word is, let me just have a look. I want to get an example from what we just saw. Okay, nervousness. Remember the one that said in the text, it said nervous. If you directly put that into the gap, it would be incorrect because it's the wrong word form and you needed the noun, so you need nervousness. So that is the biggest thing to pay attention to, is transforming that word to fit the gap grammatically. Jace, just make sure you write your email to hello@e2language.com, not e2.com. Part A reading, should we use capital letters? Spelling, I know spelling's important. No, I don't think you should use capital letters unless you need a capital letter. For example, if you're talking about Alzheimer's disease or the name of a person or something like that. Since the OET has been recognized in the UK, does that mean that it will become more difficult for the coming exams? No, the difficulty level stays the same. They've added the C+ grade in between the C and the B, which is, I think the C+ grade is the equivalent to a IELTS 6. Is that correct? I can't remember. I'll have to look at that. But no, it hasn't increased in difficulty. Clara, how can I know when I am ready to take the exam? You can download the practice tests from the Occupational English website, and they give you sample tests, and you can practice and put yourself under time conditions. And if you need any help, you can come and talk to us. Onelink, the E2 Language website only has 3 writing assessments. I want to get more feedback on my writing. Where can I get more practice and feedback? Good question. We are currently updating our website with more material. So I think the writing will be ready in about a week, and that will include, we're going to have, I think, 2 more subtests up, including practice exercises. So if you can be patient for another week, you'll see that. We're also updating the reading section as well, including lots of reading part B and several more papers on that. So just please be patient with us and stay tuned, but we'll let you know when the material's up. In the meantime, if you're a paid member, yes, just please be patient with us. Vimala, please give us hints in speaking. Please check out my speaking webinar live class over there if you want to do that, or listening, same thing. I've done hour-long classes that you can watch there. In reading A, how much questions out of 30 should be correct to pass? That's a good question. I've had students who have probably got 20 out of 30 correct, and they still got a B grade, okay? So I think it depends on the test, but you certainly don't need to get 100%. I think you can get away with like 80% to get a B grade, but I'm not entirely sure. The money we need to get right part A to pass. Oh, sorry, how many? I just answered that one. Well, thank you. I need more writing subtests. 1 test is not sufficient. Well, if you're a paid member, you'll get 3. If you're a paid member and you haven't got the 3, please email hello@e2language.com. Pooja, recently I gave OET and I scored C in reading. I'm practicing a lot, but I'm not improving. Please help to improve my reading part B. Yes, I think reading part B is super difficult. Very, very tricky stuff. Let me just have a look on YouTube Live and see what questions we've got. Jay, in the writing, if the case note has a note of today, I don't understand. Okay, oh, sorry, here's the rest of the question. Jay, in writing, if the case note about today's examination, what tense should we use to write that information in the letter, past or present tense? Zaira, if you're interested in grammar in your letter, please check out type into YouTube OET grammar. I've done a series of videos on what verb tenses to use in the letter. Okay. Any more questions? Yes, Bhawana, please email hello@e2language.com. Cool, that's all good. People are asking about speaking and listening, but just please watch my other videos here on YouTube. And if you're on YouTube, please click like, leave a comment, and don't forget to subscribe. Thanks very much, guys. I'll see you soon. Good luck with your tests, by the way, but I'll probably see you before then.